So Jupiter Medical Center celebrating a recent recognition. The hospital just named an NPF Center of Excellence for Pancreatic Cancer by the National Pancreas Foundation. Here to tell us about this distinction, this honor, and what it means for all of us, for our community, is Dr. Chanel Bhagwandin, Medical Director of the Gastrointestinal Surgical Oncology Program there at Jupiter Medical. Doctor, thank you so much for joining us this morning. I understand there are other centers across our state. Tell us what separates yours and what makes yours stand apart from the others.
Well, thank you for the invitation to talk about this recognition. Center of Excellence primarily focuses on top-tier hospitals and centers that are focused on the multidisciplinary approach to pancreas cancer. The dedication and the focus on the whole patient in terms of treating with all the available resources and, of course, improved outcomes and consideration for quality of care. In terms of Jupiter Medical Center, our large volume of patients is one aspect of it that we see and treat, but the National Pancreas Foundation looks specifically and critically assesses those outcomes as well as the available resources to treat the whole patient. We utilize a multidisciplinary approach to pancreas cancer that involves all treatment specialists, which in itself can be one of the limitations to this disease. So in terms of centralizing that care, in terms of a center of excellence like Jupiter Medical Center, the necessity for that was born out of patients' need to find specialists in one place, make sure the diagnosis is correct the first time, and streamline the process so that patients can get a timely workup and treatment recommendation.
Because what happens if you don't have that multidisciplinary approach, if you don't have those sort of resources, what kind of obstacles would that patient have to deal with?
Yeah, and it's a great point because, like I said, it is the nature of that, but it is specifically that, the delay. Any measurable delay in diagnosis and treatment workup can lead to progression of disease where patients may not be able to have an operation, may not be able to get treatment because this is something that is quite aggressive and can move just as fast.
One of the deadliest cancers. So explain to me, what are those symptoms we need to look out for?
Yeah, so the symptoms unfortunately are non-specific. So low back pain, it is commonly associated with weight loss. So patients will have ongoing weight loss, loss of appetite. In terms of masses that can develop in the head of the pancreas, sometimes we can see invasion into the bile duct where patients can get jaundice or yellowing of the eyes.
And so those are sort of some of those signs. Are you seeing those? What age typically do you start seeing these?
Typically in men, usually in the age group of 70s.
Okay.
Similarly with women, but more commonly among smokers. And in fact, recently we've recognized that adult onset diabetes after the age of 50, that we're seeing patients develop diagnosis of pancreas cancer typically within 2 to 3 years of that diagnosis. So it's important to pay attention to that and sort of make that corollary because it usually doesn't become the link or key between saying, well, diabetes, cancer, but there is one.
Sure, and I'm sure a lot of research and a very interesting world to be in for you. You could change and save a lot of lives. Doctor, thank you so much for being here and joining us in studio this morning. I want to give you a little bit more information at home. If you're wanting this, go to jupitermed.com and you could read more about their different approach, their unique approach to pancreatic cancer and diagnosing it.